What's up everyone, hi, how are you? Welcome to Rally Pharma. This is World's Best Doctors channel. You guys know that, right? Yeah, so we are continuing with our series of careers in pharmacy, and today I have a special guest. Guys, you know how we welcome our guest here? Let us do our drum rolls for him. Thank you. So hi Dr. Welcome. Kindly introduce yourself to my audience.
So good evening. Thank you, Linda, for coming. I'm Dr. Hilary Kagwa. I'm a clinical pharmacist by profession, and I'm also the acting county director of health, Kiambu County. Welcome to Kiambu.
Oh, thank you so much. So today we are going to talk about clinical pharmacy as a career in pharmacy. And Dr. kindly tell us what is clinical pharmacy, or who is a clinical pharmacist?
Thank you. I think the first thing would be to define what the profession is before we come to the human resource aspect. So clinical pharmacy is an aspect of pharmacy practice which is more patient oriented than product oriented. And basically clinical pharmacist looks at three main issues. The effective use of medication, safe use of medication, and cost-effective use of medication. So if you are in any practice of pharmacy, if you are able to address those key aspects of practice, that is clinical pharmacist. And it's toward the patient. It's toward the patient-centered care. And normally practice in a multidisciplinary team. We don't work alone as clinical pharmacists. We are just part of a larger multidisciplinary healthcare team that consists of consultants who can be physicians, surgeons, gynecologists. Then we have medical officers, nurses, nutritionists, everybody in a healthcare team. But from a pharmacy point of view, when you're looking at the medication use, you are looking at effective use of medicines, safe use of medicine, and cost-effective use of medicines. If you are able to do those things, you are good with clinical pharmacy. Thank you.
Okay, yeah. So now let us look at a day in life, like your roles and responsibilities. How does the day in life of a clinical pharmacist look like? Like, what do you do that will set you apart from someone in the clinical, or someone in the community pharmacy, or someone in the industry? So how is this field like unique? Tell us about like what you do on a daily basis.
So I think I practiced a lot in the hospital pharmacy before I came into the county director's office. So I'll tend to be biased through a hospital perspective. But basically what we need to have in mind is that you just practice in clinical areas. Which are these clinical areas? Is where you have a direct interaction with the patients. And when I say that, remember in a hospital setup you can have direct patient interaction at various points of contact. The first is the pharmacy. As you are dispensing, that's also an avenue where you can interact with the patients, either at the dispensing area, or you can have a special room assigned for patients where you do counseling, or what we call MTM, medication therapy management. So that's one. The other area that I used to practice, or I can practice, is at the wards where the patients are admitted. Remember, there are ward rounds that are conducted either as a pharmacy-led ward round or as a general ward round led by the larger multidisciplinary team. So in the wards, that's another area where clinical pharmacy practice can be practiced or is practiced. The other area in the hospital is clinic. There are so many clinics in a hospital. There is what we call medicine outpatient clinics. There's hypertension clinics, although they are part of MOPC, diabetes clinic. There are all kinds of clinics. So that's also another area I used to practice, especially at the NCD, non-communicable disease clinic. That's where you find most of the patients ailing from diabetes, hypertension, heart failure. Some oncology cases came, mental health issues, COPD, asthma. So there are those special clinics where the services of a clinical pharmacist can also be practiced and be of benefit to the patients. Thank you.
Yeah. So now you mentioned earlier that you are the county director of health, Kiambu County. So because I'm asking about roles and responsibilities, could you touch on some of them?
Thank you for that question. That question I think is very broad, but I want to believe you're asking basically what do I do?
Yes, that's what I want to understand. It's true. Yes.
So basically, being the county director of health, Kiambu County, I'm the technical advisor to the chief officer and the cabinet member for health or the CEC at the county level. And basically, the day-to-day is just coordinating of the technical aspects of the health delivery in Kiambu County. Like below me, there are 4 directors. There's the director of medical services, there's the director of public health and sanitation, there's a director of planning and administration, and a director of nursing. So under all those directorates, there are so many activities. So me at the top, I just coordinate all those directorates to make sure they are working together for the delivery of efficient healthcare service, especially service delivery to our residents in Kiambu County. And the other also important role for the county director of health is being the contact person. Remember, health is a devolved function. So there are those functions that remain at the national level, especially to do with policy, training, and regulation. But most aspects of healthcare were devolved, especially the actual delivery of the services. So wherever there's a communication between the Ministry of Health, the Council of Governors, and the county, I act as the link person. Whatever they want to do, they want anything from the county, or they need to do something in the county, or the county want to engage with the national government. Basically, the office of the county director does that. Thank you. Okay. But and a lot of other things I cannot mention in one statement. I wish you will stay here one day, you see what I do. Thank you.
Okay, fine. Now let us look at now the clinical pharmacy practice. How does someone actually come to be a clinical pharmacist? Are there any special training that someone does, or with my BPharm I can be a clinical pharmacist?
So, thank you for that. Clinical pharmacy is a specialty in pharmacy. So like any specialization, you must have the basic or the fundamental qualification. So first of all, for you to be a clinical pharmacist, you must have a degree in pharmacy. That's a BPharm. In our local regional setup in America, you can have Pharm D. But basically, that's the fundamental graduation you have. Then from there, you pursue clinical pharmacy as a specialties or at a master level. And clinical pharmacy is wide and it's growing day by day. Like for me, I know I specialize in internal medicine, clinical pharmacy, and critical care clinical pharmacy. There are other aspects of surgery in clinical pharmacy. There's infectious diseases, there's oncology, there's reproductive health. Now we have pharmacists coming up with oncology, radiopharmacies. It's also part of clinical pharmacies, but it can also be classified on its own. So as you can see, clinical pharmacy, it has so many, it's a growing profession, and there are so many areas that you can diversify into. So you have to have a BPharm, then you go for a master's. It normally takes 3 years, and then you also do a project, and then at least now we are given licenses as specialist pharmacists, as clinical pharmacists.
Thank you for that introduction about like a master's in clinical pharmacy. Now let us look at challenges. I know this is relatively like young profession, like clinical pharmacy, and there are various challenges that like clinical pharmacists face. So as a clinical pharmacist, are there any challenges that you have faced before and or you're still facing, and how do you just address the challenges?
Yes, like rightly put, challenges are there in life. I think they say when you have no challenges in life, I think you are as good as dead.
Yeah.
So, but that was all right. But clinical pharmacy, remember, it has not been there for quite some time.
Yeah.
So at least now, since where we started, I started practicing in the year 2017, but I know others who had come before me had started. Yeah. The issue has been the buy-in. Remember, it's a new aspect that has been coming, where now pharmacists leave the traditionally taught product-oriented pharmacy practice to patient-oriented practice. Yeah. I think in the 80s, they could not envision a place where a pharmacist could have one-on-one interactions with a patient. Yeah. So when this aspect of pharmacists interacting directly with patients came in, for those who are originally or traditional part of the healthcare team, it was a challenging time. They really didn't understand what clinical pharmacists are supposed to do. Yeah. And of course, the challenges will be, perhaps they don't think your input is important because you have not been there before. They wonder what kind of services you can offer. Yeah. But now I'm glad to say, with consistency and with the time, when you continually show them why you need to be part of that team, when it comes to the choice of medications, you because it's a multidisciplinary team, it's a respectable two-way relationship where you showcase what you can offer for the patient, and also have a way of having a baseline before you started offering your services, and after some time, you can have measurable, achievable outputs as regards patient outcomes. So initially there was that resistance, or people really don't understand what you really do. Yeah. Then after some time, because of being part of that team, showing the especially when it comes to issues to do with therapeutics, because basically that's where we are. We show indication. You discuss with the part of the healthcare team, is this the right drug for this patient? So that one is indication. The other one is E, effectiveness. The drugs you have chosen for this particular ailment in a patient, is it working in the right way? So you look at the issue of compliance, quality, so that is effectiveness. Then you go to the issue of safety. Is the drug safe to the patient? So some of these things you'll find prescribers or the medical practitioner will just prescribe and leave it out. Then the patient is suffering some safety issues, maybe of severe adverse drug reactions, drug-drug interactions, drug-food interactions, food-drug interaction, and what have you. So as part of that thing, when you're able to address such issues, then the last one and not the least, compliance or adherence. It's a very important aspect of patient care, where you sit down as a pharmacist with the patient and talk about compliance with medicines and medical devices. I can give you a practical example. Many patients with COPD and asthma, they are having these recurrent attacks, not because they are not using the right medicines, but if you sit down with them and assess how they are using the inhalers, you realize the problem is the use of the device. So, like I was able to do that at a facility I used to work. We were able to do a baseline where we are having this increased monthly admissions of patients with asthma. So we, as a pharmacy team, we sat down with the patient for a period of 1 month, just taught them how to use inhalers, how to avoid the triggers. Then after 1 month, we did another survey. We could see the number of admissions in a month, the number of lost years, as in the patients do not go to work, they come to the hospital, they reduced. And that's how clinical pharmacy can show the importance. So initially, yes, there were challenges, but with the time,
at least it gets better.
The other challenge I can notice is that there was a bit motivation by some, because of lack of recognition by the Pharmacy and Poison Board, but now we are glad we are being recognized by the government of Kenya, the PPB. And also in some counties might complain they don't recognize the role of clinical pharmacists, but I'm glad, like the county I work, Kiambu County, in fact we are encouraging more to go and train, because we have shown the benefits you can offer our patients. So maybe the other challenge will be some counties are really not embraced the idea of clinical pharmacy, but we are hoping with continuous advocacy and awareness, they'll take up these services. Thank you.
Yeah, so now let us look at right now, like from the year 2017, not even 2017, 2016, I think the government is not like posting pharmacists. So now if we look at the pharmacists who are out there, would you really like encourage them to venture into clinical pharmacy practice? And are there like adequate job opportunities that can actually encourage someone, like after they've done their BPharm, they can go and specialize in clinical pharmacy and they'll be able to be absorbed there?
Linda, there's something I mentioned, is that the benefits or the fruits of clinical pharmacy, they have come with the time after showing the benefits.
The benefit,
So remember, even when it comes to employment, the county government, the national government, they are our employers. When they are looking for employees, they are looking what is the cost benefit analysis. If they are willing to pay the salary of a pharmaceutical technologist or a pharmacist, what value are they adding? And I'll say, for Kiambu County, we normally have yearly what we call a training needs assessment, where we assess at all the specialties, including surgeons, obstetric gynecologists, gastroenterologists, pediatricians. So we look at the numbers we have and the numbers we need. Then, of course, we have clearly, one of the things we did as a county is for the pharmacy profession, we came out with the very specific job descriptions of specialties in pharmacy. So as a clinical pharmacy, there's a job description. We are hoping it can be adopted nationwide, but as a county, we have a JD for clinical pharmacists in Kiambu County, what is expected of you. So by continuously adhering to those JDs and delivering on the deliverables and achieving positive patient outcomes, the county has come to appreciate the role of clinical pharmacists. Right now, we are 8 clinical pharmacists in the county, and I can show, and we have 14 level 4 and 5 facilities. So even by just looking at one in each, you see 8 minus 14,
there's a deficit.
There's a deficit of already 6. And remember, one is not enough for a hospital.
Yes.
I told you I've done internal medicine and critical care.
Yeah.
My colleagues have done pediatrics and infectious diseases. So you'll find in a big hospital like Thika or Kiambu level 5, they might even need up to 3 or 4 clinical pharmacists. Yes. One who has done clinical internal medicine, one who has done critical care, especially now with the ICUs and the theaters. One who has done pediatrics for the to do with pediatric issues, mental health. So it's an area, as long as those who are already in service can show positive outcomes or the cost benefit analysis of the it's triggering, it's falling toward the benefit side, there will always be a vacuum for their services. They are really needed. And you see, how do you measure the positive outcome? When you are having less cases of patients having ADRs, using cost-effective medicine to treat most of the condition instead of using very expensive drugs for few conditions. So those are the benefits that you can show to the county government, and they invest in your services because you are lowering the cost of healthcare and also improving the patient outcomes.
Okay.
Thank you.
Yeah, so finally, as we come to the end of this video, I would like to give you, I'd like you to give us a parting shot or an encouragement to any young pharmacist outside there. What would you tell them to do?
You know, I wish I was a preacher. I'm really passionate about clinical pharmacy. I'm really passionate about my patients. I still miss them. And I didn't mention to you, I've also done renal pharmacy preceptorship care. So patient on dialysis, I used to follow them. And what I want to encourage somebody there, especially the young pharmacists. When you are done with your undergrad, go for internship. Go for the hospital pharmacy practice, go for community, go for industry, go for the primary health care. Then as you are rotating in all those rotations, try to learn as much as you can, because at the end of it all, you know where your heart lies. I know some of my colleagues, right from the word go, they were agitated toward industry. So immediately after internship, they took that route. For some of us, we chose clinical practice and hospital pharmacy practice in the public sector. There are people who are doing very well in community pharmacy, but practicing clinical pharmacy in a community pharmacy, community pharmacy setting. Look, after the COVID pandemic came, look at the Americas. Look at in the America and the UK. Pharmacists have been engaged to offer immunization services.
Yes, it's true.
That's a community. That's more of a clinical pharmacy per se. And now with the expanding of the healthcare services, pharmacists should also take up family planning services in the community and also in the hospitals. There's that what I've talked about vaccination, and not just for COVID, for other conditions. And even the other aspect of just patient walking in, even in your community pharmacy, and just being a counselor on healthy lifestyle. Stopping of tobacco use, lifestyle diseases, how to take care of diabetes, hypertension, their diet. I think we have pharmacy has been opened up. Remember, I'm biased toward hospital pharmacy practice and clinical pharmacy, but if you look at pharmacy practice in entirety, it poses a lot of avenues. You can go to regulatory affairs, quality affairs issues, industry. You can do academia, which I think is also a very good place for research and development, and there are many specialties in the pharmacy profession, including toxicology, molecular pharmacology. So there are so many areas, including forensic pharmacy. You remember forensic issues there, especially in the criminal justice system. So my parting shot to pharmacists is it's a bit crowded than earlier, but the opportunities that are there are still also growing by day. So I want to encourage you, if your passion is in pharmacy, do it with a passion. Have a goal in mind, then pursue that goal, and then we always have a mentor. If it's quality, look for somebody who does quality or regulatory. At least have a mentor-peer relationship. If it's clinical pharmacy, look for people like Dr. Kagwa. We are here to assist you, and I am glad there's a program run by Odhiambo for young pharmacist mentorship program. That's a very good program too. To even open people's minds on the area that they'll want to venture in. I love a lot. I have liked to say a lot, but we can talk much more later. But it's a good profession. We enjoy it, and I'd want to encourage us to really have a keen interest in it. Thank you.
Yeah, so thank you so much, Daktari. As we come to the end of this, I would like to thank you for this opportunity. And guys, I'd like also just to thank you for watching. And if you have any questions for Daktari, kindly let me know in the comment section. And in case you have also any other comments that you want, please just let them in the comment section and we'll be able to interact. So thank you so much guys, and I'll see you on my next video. Bye bye.
Bye.